My dear students, today I am bringing out the first lecture of ENT. I will be giving in a series all the topics in ENT from this onwards. My first topic is Introduction to ENT and Head and Neck Surgery. I myself, Dr. P. Dhakeswar-Professor, I am the Professor and Head Department of ENT, Jennings, Imphal. Now, what is ENT? ENT stands for ear, nose, and throat. Then why ENT? There can be eye, nose, and throat, or like that. Everyone is confused sometimes when we talk about ENT. And why ear, nose, and throat? Yes, they are morphologically, developmentally, and functionally related. There are some questions here which you can ask, like why you have a feeling of blocked ear after landing from a flight. What is it? It is nothing but a blockage of the eustachian tube because of changes in the pressure inside the aircraft, which leads to this problem. Why you have ringing in the ears when you catch cold, especially after blowing your nose? It's because nose and ear, they are very much related, and the connection is the eustachian tube. That is the connection in between the middle ear compartment and the nasopharynx, that is the space just behind the nose. Why you have facial palsy after an ear eruption? And sometimes you'll find vesicles in the ear. After that, after some days, you will have pain and there will be paralysis on one side of the face, that side of the face. Okay. Then why you have an earache when you have a tongue ulcer or a toothache? This is because all these structures like ear, nose, and throat, they are interrelated, and the nerve supply are connected, and they are common nerve supplies, which leads to all these problems. In ENT, we are dealing with the most sensitive part of the body, concerned with the well-being of human body as a whole. And it is the most beautiful and presentable part of your body, and we recognize you by your face. First, it is concerned with hearing and speech, which are essential for quality of life and survival. And communication is the most important tool for learning of any individual. At the same time, it will be the most important tool for employment. And smell. Smell also gives quality of life. At the same time, loss of smell may be hazardous. When you cannot smell a gas leak in your kitchen, you'll have problem. When you plug on the light, there will be a sudden explosion. So smell as such, without smell, your food doesn't taste well. At the same time, we can remember smell. Even my parents smell. My very close ones smell also. Subconsciously or consciously, it can bring back a lot of say memories and warmth in our psyche. Then taste and flavor. They are also essential for quality of life. If you eat and if you don't have any taste, then there is no point in eating. People will not feel like eating at all, even though you need a lot of nutrition, which you may have to say. For example, you are done gastrotomy for some problem, and you don't eat through your mouth. You just put those things inside your stomach directly. How will you feel? It's not a very pleasant experience. It's not it. Now balance. Balance is also a very intricate and delicate function of integrated eye, ear, the balance part in the ear, and the neuromuscular junctions and the nervous system, including joint sense and all. So without balance, just think over when you are feeling very imbalanced or having a reeling sensation or vertigo, and how will you feel? Then facial expressions. Nowadays we are using a lot of emojis in messages, in our WhatsApps, Facebooks, wherever in the mobile. So facial expressions, when you look at somebody's face, we said that face is the index of our mind. So everything that you are expressing is on your face. So when somebody loses the facial nerve and the facial expressions are lost, the person will be having a hell of a time, and all his dignity and self-esteem will be lost. And the most important thing is that the most complex structures, intricately packed in tight spaces in ENT. All the structures are related to each other in millimeter or micrometer distances. So the margin of error in any surgery is very minimal. And another thing is that the most exposed to injury and natural oxidizing agents, most emotionally related part of the body, it needs the greatest experience of medical science, greatest expertise of medical science. Yes, why not? Because everything that we are concerned with, our lifestyle, our mental and emotional integrity, is everything in the head and neck. All structures of the head and neck are developed from 6 pharyngeal arches and the clefts and pouches. The structures are supplied by their corresponding nerves and vessels. Likewise, so all the muscles of the mastication, that is for chewing, are supplied by the mandibular branch of the trigeminal nerve, except buccinator supplied by the facial. All muscles of the face and scalp are supplied by the facial nerve, except temporalis and masseter supplied by the mandibular branch of the trigeminal. All muscles of the larynx are supplied by recurrent laryngeal nerve, except cricothyroid supplied by external laryngeal branch of the vagus. All muscles of the pharynx are supplied by cranial accessory through pharyngeal plexus, except stylopharyngeus supplied by glossopharyngeal nerve. All muscles of the tongue are supplied by hypoglossal, except the palatoglossus supplied by cranial accessory nerve. Now, let me introduce to ENT. How the treatment has changed in the last 1 century. In the medical science, the last century from now was instrumental in changing the outlook of diseases and their treatment. And what are the new advancements? Do we need to change our concept of ENT is a small part of the body? During our time when we were doing MBBS, we thought that ENT is a small subject. Yes, it is a small subject, a small part of the body. As compared to abdomen, head and neck is a very small part. But a large part of the abdomen and its contents can be sacrificed without risk to life. Can we do it in head and neck? No. In head and neck, when you cut, the margin of error in the surgery sometimes is less than 1 millimeter. So the best hands in the surgery field should come to ENT, head and neck surgery. How do you enter the brain? We have neurologists, neurosurgeons, and operation on hypophysis and the skull base is very challenging today because they have to approach from outside, But in ENT, we approach from inside the nose. Nose is the cavity which is given by God to us. Just above the nasal cavity and the nasopharyngeal cavity, we have all these structures. And also directly through the nasal cavity, we can, through the sinuses opening. Once we open out the sinuses, the skull base is easily approachable, and any disease in the skull base can be treated without any problem, without any hazardous consequences. And it is the beginning, but this beginning is too late a beginning. It should have been there from the beginning. And here all of you are invited to proceed in this new beginning of ENT. In ENT, endoscopy has brought a lot of changes in ENT, because all the structures in ear, nose and throat, they are concealed inside. What you see outside as ear, it's just a pinna. That is just a fraction of the whole of the structure of the ear. The most important structures are already embedded deep inside. Look at the throat. What you see from outside. Inside there are two tracts, the ear tract and the digestive tract. So all these tracts are easily treatable with the endoscope, and they are easily diagnosed by endoscope. But earlier it was really difficult before the time of the endoscopes. Then about the nose. You see two openings in the nose, but the cavities inside the nose is huge, and there are a lot of sinuses, other cavities which you need to prod through the endoscope. And why endoscope has brought out such a big changes by the precision, the visibility, and minimal invasive techniques that can be done with the endoscopes, and it is very less traumatic approach, and the early diagnosis and treatment is achievable without much side effects. And we have new anatomy, new physiology, and new basics. Earlier we used to think that the anatomy and the physiology was already established. No, they are still evolving, and the further you go and when you do better with the endoscope, then naturally everything changes. And overnight treatments have changed. So now we have different approaches without any surgeries. We are trying to avoid big surgeries like seal endoscopy. What is seal endoscopy? That is through the tract of the salivary glands. By endoscopy we can approach inside the lumen of the salivary gland ducts, and we can remove the stones from there, and we can diagnose the structures, the diseases lying deep inside the salivary glands. Then we have the functional endoscopic sinus surgery for the sinus surgery. Earlier there was a lot of external approaches. Now only the internal approach through endoscope is the treatment of choice. Earlier there was a lot of surgeries being done which were a lot of debilitating surgeries and taking a lot of time, a lot of cuts, but now it has changed. So the endoscopic intracranial procedures, then base of the skull procedures have come to stay, and there is no end to it. It is keeping on evolving. You can see the structures here through the CT scan, and the CT scan and MRI and PET, all these things have come with a lot of boon to us. And the side of the nose you can see through the endoscope. Polyps you can diagnose easily, you can treat it easily also. At the same time you can drill inside the nose with a lot of instruments like say micro debriders, and the treatment has become very much easier and more effective. Earlier we thought it is a small subject. It is still a small subject, Now ENT is being divided into subspecialties like otology for the ear, rhinology for the nose, phonosurgery only for the speech and voice production, head and neck surgery for all the say structural changes and diseases in the head and neck area can be treated by head and neck surgery. Then skull-base surgery, otoneurology, then oncosurgery. Otoneurology stands for the neurological parts in the ear, and also the oncosurgery for the tumor surgery. So all these are the subspecialties being divided in ENT nowadays. And what we are being taught in MBBS is just a preliminary in the ENT, and does an MBBS student has enough skill or knowledge to treat a patient of ENT in casualty? This is a big question. And is our syllabus misleading a medical graduate, or are we giving them enough knowledge to deal with the ENT problems after passing MBBS? The question is, where are we? We need to evolve the education system and the way people have been thinking about ENT and its prospects. I conclude my first lecture here. Thank you very much for patient listening. Bye-bye.